They asked me if I felt that there was stress in the workplace, and I started laughing, and I said, "Is this a trick question? Like, am I going to answer you the wrong way here?" Right? Of course there is.
It's like a boat taking on water, and you try to bail and try to do the work, and you're not getting anywhere. In fact, you're sinking. And that's basically the feeling I felt. It's like being on a ship that was going down.
You know, you come home, you take it out on your husband, or you don't want to do anything. You just want to come home and just kind of sit down.
When most of us think of occupational hazards in an office, we usually think of problems like poorly designed work areas, bad lighting, or exposure to harmful chemicals in equipment, carpeting, or the air. But sometimes the worst hazards are the least recognized. Stress is a perfect example. Stress may not be as obvious, but it is a very real occupational hazard. And like other occupational hazards, it is crucial that stressors be identified and eliminated for a safe and healthy working environment. Stress in offices comes from a wide array of sources. For Debbie Norman, a CAW member and secretary at a large telecommunications firm, trying to cope with all the changes around her led to intense stress. Changes in technology, an increased workload, and after restructuring, job insecurity.
The stress level here has increased rapidly in the last 12 months. And no, at no point ever have I felt this way in all these years at this place. And because people are having to be retrained, it takes longer, it causes frustration, and the downsizing itself is causing people to, everybody to fear about whether you're going to have a job tomorrow or not. And that causes anxiety.
For Peter Hutchins, stress had a different origin. An OPEIU member and former constituency assistant at Queen's Park, Peter was working in an MPP's office that was understaffed. Even as a key employee, he was never given a chance to participate in office decisions.
I was the only person in the office, so normally an office like that would have 2.5 staff to handle casework. We had 1 full staff to do correspondence from him and from myself. We were short-staffed, and we were taking on more casework than other offices did. Finally, the employer decided to start having some staff meetings, but there was no real input encouraged from the staff. It was all downward. And, that's not a good way of doing things, because we can see, the staff on your ground level can see what maybe could be improved.
Peter's boss kept adding to his workload, and at one point, Peter felt he was being harassed. Eventually, the stress became unbearable.
I remember the day I had to, we had to give notice that I wasn't coming back to work. I broke down in tears, just like that, and I was very embarrassed.
In Kathy McIntyre Jones' old office, stress preyed on nearly all the workers. In this case, one of the major problems was a lack of variety on the job. Kathy, an OPSU member, was a data entry operator at the Hamilton OHIP offices.
It was the data entry operator. You sat at a VDT machine from the moment you went into work until you left that night. That's all the job consisted of, was inputting data. You got headaches, tired, self-esteem would get low, felt you just couldn't live up to what they wanted you to do, so you strived and strived and strived till you were just knocking yourself out.
Like many monotonous jobs, Kathy's position also suffered from low status and lack of appreciation. 2 other stressors that can make a bad situation worse.
Anything above us was a promotion. So we were at the bottom of the totem pole, and you were made to feel that way. You know, like, well, we're higher up than you, and this is just what you've got to do to keep your job.
Whether it's coping with change, work overload, a lack of variety, or poor ergonomics, the sources of stress are all around us. Still, many workers are reluctant to bring the issue to an employer.
Workers don't bring forward their concern about stress because it's not something concrete, such as a broken arm, using that as an example. And workers are more likely to use whatever sick days they have than be harassed by the employer. That's a proven fact. We have more workers who are willing to do that. Another part, and it's a history of stress, is that person is looked upon as being imbalanced, a little bit crazy, or they're just having a bad day.
Even though some employers may be reluctant to accept it, stress symptoms are real, and they are serious.
I was getting a bit melancholy and depressed for extended periods of time. And I went to one doctor, and he just thought, oh, that's, he was an athletic physician. He used to teach or work with athletes, and he just didn't think this depression. He wasn't really up on that. And I said, well, how the hell can you live like this? I'm not eating properly, I'm not sleeping, I'm very unhappy, getting mouth ulcers and, agitated, I can't concentrate.
Occupational stress is very real. The symptoms can take the form of worry, excessive worry, people who are thinking about their jobs well after the job is over, anxiety, a tendency to feel shaky inside. The anxiety can affect the body. We can get palpitations, we can have chest pain, we can have tension of the muscles of the head, the muscles of the neck, the shoulders, the back, the legs. Just a second. Migraine headaches can be aggravated. Blood pressure can be aggravated, as can peptic ulcer.
In addition to these symptoms, stress can have effects on the body that wreak havoc over time. Heart disease, suppressed immune system, cancer, depression, insomnia, and stroke are some of the potential serious effects. But identifying the symptoms of stress is only half the battle. The other half is finding solutions. For Peter Hutchins, the first step was keeping a record.
But I documented everything. I mean, that's one thing that people need to know. If you're in a situation where it's stressful, you try to resolve it, obviously, like an adult, between adults. And if it can't be done that way, you document everything and you bring your union into it. Right away, don't let anything slide. And the problem is, if you do let things slide, it's difficult to resolve it later on.
The best way not to let things slide, as Peter says, is to involve your union. Joint health and safety committees are the best place for workers to take their concerns. Meeting with the Joint Health and Safety Committee is the first step. Union reps on these committees have developed many concrete solutions.
I think that their first option is to go and seek advice from the Joint Health and Safety Committee, and you ask for advice. And I would bet you that many people in the office are experiencing the same kinds of symptoms as this individual who has gone to the Health and Safety Committee. So it's very crucial for the Joint Committee to do a survey of the work locations, at the work locations, to find out how many people are experiencing these malaises or these stressors in the workplace.
Surveys can help identify the stressors. The Health and Safety Committee can help come up with the solutions.
If you are doing repetitive work on a machinery, for example, that you rotate that job with other people, or if the problem is a manager who is a bit too authoritative, you deal with ways in maybe educating that person that this is not how we manage in the 1990s anymore, that it's, managers have to be cooperative and have to allow a lot more control of the work by the employees in the workplace. So those are the things that I would suggest this person to do, is to speak to the Health and Safety Committee.
Probably one of the biggest things that can be done is in terms of worker empowerment, making it such that the workers have more input into the design of their jobs, the workstations, how they're laid out to make sure that they're ergonomically correct and safe. Putting variety into the tasks of the job so that you're not always doing the same thing over and over. You're avoiding that repetition. Building more interaction with co-workers and other people into the job so that you're not felt isolated all the time. Those are probably the key factors that workers can do now to avoid the stress.
John's union is working on implementing these basic preventive measures.
We're trying to, as much as possible, deal with those kinds of situations by looking for increased employment levels, by doing more work sharing amongst the workforce so that no one person is having to be overloaded. We are introducing education programs into the workplace. We're doing a lot of work around empowerment to make it such that our members have input into the job design and what have you.
And as Kathy discovered, OPSU has been working hard to combat stress and making inroads. The union organized workers into stress groups to achieve a better understanding of the problems of stress. They filed complaints with the Ombudsman and conducted studies on the subject that are used to confront management.
Well, the union been fighting it constantly, so the girls would back the union on it. Some of the ones up at Human Resources that worked with me when I came back to work were wonderful, and they tried to do everything they possibly could. Some of the management in this building, I wouldn't say the same about.
Stress is an insidious threat to the health of working people. But with awareness, discussion, empowerment, and action on the part of workers and their representatives, there can be real and lasting change.
The stress issue should not be focused on the worker, and it should be focused on the workplace, and we should be able to come up with solutions to deal with workplace stressors as a collective, not as an individual person.
When we do get empowerment in workplaces, employees can have a major say. And where we have that, we find that things have improved significantly. Not only is it a healthier and a safer place, it's a more productive place. And that the employers see as a real benefit. That's their side of the equation. It's a win-win situation.